Welcome back to the September 17th edition of Generations Expo Virtual event, sponsored by Northeast Georgia Health System. I'm Will Hammock with the Gwinnett Daily Post. Our next guest is from the recently opened Royal Blue Medical Center in Lawrenceville. Welcome nurse practitioner Laquan James.
Hi, my name is Laquan James. I'm a nurse practitioner. I did get a nursing and biology degree, came to Georgia, and I started working in the ER as a nurse in the ICU and ER. So what got me into healthcare was my grandmother had diabetes when I was a kid, and I always kept her compliant with her insulin because I wanted to do it every time. So, and also another thing that really got me into healthcare was I saw a lot of homeless people, and when I was young, I was like, gosh, I wish I could help them. I wish I could help them. And so that really is what got me into healthcare today. I want to be the one that is the sole culprit for that person being healthy or living again. So that's why I became a nurse practitioner, because I'm given that opportunity to be the head of that person's healthcare and take the full advantage of getting them back to 100% as best I can. So how did I become a part of the Royal Blue family? I really want to help people in more ways than one. Like, I don't want a patient to have to go to a primary care doctor for something that I can help them with here. And so their vision and their sincerity and how they presented it to me is how I became a part of this family, because they believe in what I believe in, and that's getting patients as healthy as possible in more ways than one. So what sets Royal Blue apart from other practices that are similar? It has to be our communication, the way we are a family, the way we greet our patients when they come in. They feel like it's not a doctor's visit. They feel like they can just come in and have a conversation. So I do have a lot of experience in mental health and substance abuse. So I have a natural background of wanting to get to know my patients. It's not just about coming in to get an injection, just coming in to get a procedure. It's more than just a doctor's visit. So some of the main practices that we do is we use hyaluronic acid to inject into the joints with people who have osteoarthritis. It can be done in the shoulder as well as the knee. Insurance pays for it, so we have a lot of patients that have osteoarthritis who don't want surgery. Well, this is a way to actually prevent that from happening and give you some increased function and decrease in pain. And if that doesn't work, we do a service called Platelet-Rich Plasma, which is when we draw your blood and we spin that and we inject that into the affected joint, which can also aid in a decrease in inflammation, an increase in function, and overall well-being. And it's all completely natural with no side effects. So with that platelet-rich plasma, we can inject that into any area of the body where there's inflammation, and that platelet-rich plasma finds the source of inflammation and treats it. And so we do aesthetics with it, we do injections with it, we do vampire facials with it. There's a lot of different things you can do with it, as well as treat erectile dysfunction and urinary incontinence for women. We also do hormone replacement with Bio-T pellets. It's bioidentical pellets, which we can help to decrease depression. I've had patients come off of antidepressants, increase your energy, decrease joint pain, decrease cardiovascular disease and breast cancer and uterine cancer. It can also improve your sleep. And also, of course, what we all want is to increase your libido. So it can do that as well. We have a lot of different practices that we have here that we can use to treat the whole patient. And it's not just one thing, but we offer a lot. A one-stop shop, and you love our environment, you will love us, so you will come back to see us anyway. Are we up to date on the latest technology? Yes, we are, because I am a nerd. I believe in, once I treat someone, I want to be able to tell them why, which is with research, what I read, so they know that they're getting the best care possible. We're giving them the best cream of the crop care. They don't have to worry about going anywhere else. All their questions will always be answered, and we treat everyone the way they should be treated. Is there any equipment that sets us apart from any other practice? We have what's called an Orthoscan Machine, and what that does is, as we're injecting into the joint, and I let them see when I put in the dye where I'm injecting the hyaluronic acid or the PRP, so they can see, okay, this doctor or physician knows what they're doing. I can see myself that they are in that joint. I can see how bad my knees are and I didn't know that. And so they will get the full benefit of seeing what I'm doing to educate even other people that needs these services. So how has COVID affected our practice? Much like any other practice, you know, a lot of the older generation are affected by different types of osteoarthritis or arthritic pain, but they don't feel safe when they go into a doctor's office. But I would tell you from personal experience, I did have COVID, yes, and I do understand your concern. However, when a patient does come in, we do have, we check their temperatures. We also assess to make sure they're not sick. They wear a mask as well as the provider or the injector. And so we try to do everything as best we can, and we abide by the CDC guidelines as far as what you should do when a patient comes in. So what can I tell the patients who may be delaying the procedures that they may need who are at home? Well, I say it just like this. From having my own personal experiences with COVID, I had time to reflect on life, and I put life on the back burner for so long due to being busy, working a lot. But guess what? You're at home, you're still having pain every day, you're still waking up in pain, and you have an office here that practices the CDC guidelines where you will feel safe. And so there's no need to continue to be in pain. We don't want you to be at home in pain. You can come here. You will be safe here. We also have it to where if we do have multiple patients in here at one time, they are more than 6 feet apart. Or if you want to be even more comfortable, you can sit in your car and wait until we're done with that patient, and you can come in once that patient walks out. So I understand COVID has everyone scared, and you have the right to do that. But I also want you to know that we are practicing the CDC guidelines, and we want to treat you and get you better so that you can still have a good quality of life. Because at the end of the day, we only have one life, and we don't want you to live that in complete fear, but just know that you're gonna be safe when you come to Royal Blue, from the time you walk in to the time you leave, and you'll be calling us wanting to come back just to come back.
Thanks, Laquan.